Hello, everybody. I'm glad to have you here. Those who have joined, for those who have not yet joined, please let them know so they can join us. Today, we are going to be continuing with our space. If you didn't join us for the first space that we had on these issues, you have an opportunity also to just go back and revisit that. But we discussed a lot of things, especially to do with how the law affects the provision of sexual and reproductive health rights, but most importantly, the provision of post-abortion care, but also generally on the law on abortion. Now, I know that this is an issue that many Ugandans will call dicey, but somebody has to talk about it. And these conversations are being had in various forums. We just decided to formalize one of them. We just decided to formalize these conversations and make sure that we can have them here on Twitter Spaces. Thank you very much for joining us. If you have a friend or four who has not yet joined us, please let them know that this is the place to be on this space. Joining me today is health worker David Lukomwa, and we are going to be talking to him, and he's going to be explaining to us. Last time, I hosted a lawyer, legal expert, Noor from SRHR, and health workers were being, faulted for refusing to offer abortion services to women who come to them seeking these services because of fear. But that we will talk about later on in the conversation. I just want my guest to introduce himself now. David, the floor is yours. Please introduce yourself to our listeners so we can get started with our questions.
Thank you, Daniel. I'm called Lukomwa David, a practicing obstetrician gynecologist. I am a member of the Association of Obstetricians and Gynecologists of Uganda, and also a member of the committee that is advocating for prevention of maternal mortality due to unsafe abortions. I welcome you all on this space. Hope you enjoy the session. Thank you.
All right, thank you, David. We're going to pick up the conversation from where we started with Noor. During my interview with her on this space, she asked, she told us of the law, and the law gave the right to, first of all, diagnose if a patient requires an abortion, and also to the rights to perform an abortion to health workers that are qualified. And I want to ask, do you consider yourself one of those health workers that are qualified to perform abortions, in any case, in Uganda? David.
Yes, thank you, Daniel. By the fact that I'm a trained obstetrician gynecologist, abortion care is part of the package that we take on in preventing maternal mortality and maternal deaths. So I can consider myself competent to perform an abortion.
All right. So I want us to just start there about your experiences. When you saw the topic that we sent you that we were going to talk about, what came to your mind first? What are some of those experiences that you can share as a health worker that have caught your eye over the time that you've been practicing in this arena of post-abortion care and even abortions themselves?
Yes, I think before we go into that, I think it will come along the way. I want us to at least remind ourselves of what an abortion is, which is an expulsion of a fetus from the uterus before it has reached the stage where it can survive outside. And of course, here in Uganda, we consider that as long as the fetus is not yet 28 weeks, we think that it won't be able to survive outside. So when you terminate a pregnancy before it has gone up to 28 weeks of gestation, then we consider that an abortion. On record, many of the abortions that do occur, about 30 to 40% of them actually occur on their own. They are spontaneous. Okay, but
Could you explain that a little bit more, a little bit better for my listeners? How does abortion occur on its own?
yes, an abortion happens when the baby or the fetus, the growing fetus, is removed or is terminated from the uterus. Okay, so the uterus, that's the environment where the baby is supposed to grow until it is ready to be delivered. However, if it comes out before it has made 28 weeks of gestation, that's around 7 months. So if it comes out before that time, then we consider that an abortion. Okay. So an abortion can be spontaneous, that means it can occur on its own. And about 30 to 40% of the abortions actually occur on their own without you tampering with the pregnancy at all. However, the other percentage of the abortions, they are induced. That means there is a deliberate intention of the carrier of the pregnancy to actually end the pregnancy. So those induced abortions are the ones that are causing us problems. These induced abortions can either be done safely. That means if it is done safely, it is done by someone who is skilled to terminate a pregnancy, is using the right equipment, and is also doing it in the right environment. However, because of the restrictive laws and policies in our country, you find that many of the abortions end up being done in unsafe ways. That means they're done by people who are unqualified to perform the abortion. They are using hazardous equipment. We've seen patients who are coming in hospitals and they have sticks in their private parts. They have wires pushed there. Some of them have taken drugs in very high. We've seen some people who take herbs. Okay, so they end up having a lot of complications. Um,
So
so this,
just so we are clear, David,
yes, please.
it's not just any doctor or medical worker that is qualified to perform an abortion.
No,
So
not not.
in a case where somebody has gone to a doctor who is not a gynecologist or who has not studied the things that you have studied, then do we consider that abortion unsafe?
If it is in the hands of an unqualified person, someone who has not gone through the training of how to terminate a pregnancy, then it ends up being unsafe. So they can either use equipment that are not meant to actually terminate a pregnancy. That's why I'm talking about things like sticks, hangers. Others have used sharp instruments in an attempt of breaking the sac that is protecting the baby, so that the pregnancy can come out. So it ends up being unsafe. Okay. Some people have taken drugs. We've seen some people who take jig. Others take solutions of soap, alcohol in large amounts. Others take drugs in very high doses. I've seen a girl who took like 10 tablets of quinine and 10 tablets of aspirin in an attempt to terminate this pregnancy, because she was told that maybe quinine has some effect on the pregnancy that can cause contractions and the pregnancy comes out. So these are people who come in with very bad complications which need to be managed. Yes, and of course, this unsafe abortion is the one that is leading to most of the deaths. Okay, so that's why we need to
Is
take
it right to
this.
say, is it right to say that there is a low uptake of the safe abortion because of misinformation? What have you found in your experience?
I can't say the uptake is low because there are no studies that have been done. I can't say it's low because the studies that have been done around abortions are also limited because of the restrictive environment. But what we know is that abortions are actually happening, because we are seeing this coming in with the high maternal mortality rates that we are seeing. Many mothers are dying, and abortion is one of those that are leading to many of these mothers dying. So we have to take it seriously. Some of the complications that we are seeing with these unsafe abortions that we are seeing, we see patients coming with severe abdominal pain. They have pain in their tummy because of the drugs they have taken, or because of the unsafe procedures that have been done. So they come in with a lot of pain. Some come in with a lot of with severe anemia because they have bled too much. Others come in with uterus with the holes in the uterus because there was an attempt of pushing something in there, trying to get rid of the pregnancy. You find that their uteri have been perforated by these instruments they're using. Others come in with infections because the abortions are being done in unsanitary environment, using unsanitary equipment, so they end up having having infections. So we see many of them coming in with, say, pus discharge from the vaginal area, which is foul smelling. So it is not good. Then others who have suffered these complications come up with issues of wanting of failure to conceive because something was done previously. They damaged the uterus, or some of them had the uterus removed because of the complications. They come in seeking to conceive, but it's becoming it is a problem for them to conceive. So there are a lot of complications, and of course death is also inevitable because of these complications.
So the final one is death. Well, I was about to ask you the question of what is the worst that can happen, and it really looks like the worst can actually happen.
Yes.
Um, are these issues or cases of unsafe abortions? What is their spread throughout the country? Is it upcountry areas, or is it also in the towns, and the cities in the country?
Well, when you look at the urban areas where we have the elite people, you find that the percentages of unsafe abortions are relatively low because within the urban areas, people can actually the people in urban areas can afford to see a specialist, and an abortion is done safely, so they never come to book. Then they also know about their health. They know what can go wrong, so they look for for a good service in better places. And of course, here in the urban areas, we see that many of them actually go to private hospitals, and and the abortions are done. So because these ones are done safely without complications, we never get to know about them. Now, when you come to the government setting, where the omuntu wa wansi goes, those who cannot really afford health care, they cannot pay consultation to see a specialist. They cannot buy drugs that are appropriate to perform the medical abortion. They are the ones who actually work. That's where we see many of the unsafe abortions. Okay? Because people are now trying to run to all sorts of people to see that they can actually terminate a pregnancy without being caught by the law. So they end up with complications, and therefore the complications bring them to the hospital. Okay, so in public hospitals we see them very often, and then when you go up country where the access to health care is limited, there are quite many. There are quite many, and then
I just wanted, I just wanted to bring.
yes,
Yeah,
please.
please just finish. Finish so I can ask my next question. It's burning, but I will let you finish before I can ask.
Yeah, I was saying because of the restrictive environment. Uh, Also, some people fear to come to hospital because they think that maybe when they come, they'll be reported to the police. and then they are brought in for performing an abortion. Basically, being done in hiding is the problem.
Now, that's actually the question I was going to ask. Because I have since learned that abortions are restricted and not illegal, and that's
Yes.
something they are highly restricted but not illegal per se. It's not like driving without a permit, which is illegal, from the start. Um, this is there any sort of misinformation in your experience that is leading people to opt for the unsafe abortions, especially around matters to do with the law and that fear?
Of course, our laws are not clear. They are not clear and they are a bit misleading. Uh, Abortions are restricted, but they are being restricted. There are punishments tied on the abortions. That means when you look at the penal code, you find that the person who is seeking to terminate a pregnancy has a punishment. The person who assists this woman to terminate a pregnancy also has a punishment. So because of those punishments, many of the health workers take abortions to be illegal, and they actually fear that is the reason why the person seeking the service and the service provider, all of them are in fear. So they move away from the healthcare that they should be getting, and they go to the unsafe methods. So there's a problem with the law, and actually something needs to be done, because if it is still like this, we cannot really say that abortions will turn out to be safe. Will still be unsafe.
Are they even our health workers so scared that they cannot even do it in life-saving, because sometimes we understand that abortions become a life-saving surgery or life-saving health procedure. It's meant to be done in order to save the mother's life. Even in such situations, would you say that health workers are still scared to touch this issue?
There are a number of issues. One, if you look at the law, it scares the health workers. Then, two, when you come to their beliefs and cultures, okay, that also limits them. Then the religion also comes in. So if we don't take these things together, uh, there's a problem. So looking at the law, health workers fear that when they touch someone with an abortion, whether it is spontaneous abortion or it is an induced abortion, they think that somehow the law will come against them. Then when you go to the beliefs, with look at the Catholics, they are so pro-life that when they assist someone with an abortion, they think that it's against the religion. Then also the beliefs. So health workers are still a bit reluctant. Much as there are situations where the abortions are permitted, you would find that one health worker would not really make a decision to do something, to maybe to terminate a pregnancy. They will still need to consult several consultants, and maybe the other uh, with higher ranks to make a decision to terminate a pregnancy to save a mother's life. But there are those situations where you actually need to terminate a pregnancy for the benefit of the mother. An example could be mothers who are very sick, we say with cancers, very fast growing cancers, where you need to terminate a pregnancy for you to start treatment for cancer. Then there are those who have hypertensive disorders in pregnancy. The most common is preeclampsia and eclampsia, which is the second on the list, killing very many mothers. So in case the mother is getting worse, you have to terminate a pregnancy to save the mother. Then there are cases of fetal malformations. There are those pregnancies where you do a scan and find that this baby, even if you let the pregnancy continue and the baby is born, they cannot survive. So in those cases, consider to terminate a pregnancy. Then there are others who have those who are HIV positive. severe disease, HIV stage 4, where the disease is severe. Sometimes we consider terminating a pregnancy. So in such cases, yes, we need to terminate a pregnancy for the benefit of the mother, but still making a decision is hard because of the environment.
Do you sometimes diagnose a patient, prescribe an abortion for this patient, and the patient just refuses? And if that situation has ever happened to you, what reasons do such patients give?
I beg your pardon?
As I'm saying, do you sometimes diagnose? Because now you say that you diagnose and you've given me all the situations: cancer, hypertension, preeclampsia. Do you sometimes diagnose these conditions to patients, inform them, prescribe an abortion or a termination of the pregnancy to a patient, and the patient refuses? The patient refuses themselves. And if when that happens, if you have ever experienced any such scenario, what do the patients say is stopping them from taking the advice of a trained professional like yourself?
Daniel, some of these things are a bit tricky, but we often do so. We often diagnose these conditions and we prescribe termination of pregnancy to the mother. But first of all, getting pregnant is by chance. Mind you, every time one has an intercourse, they have about 20% chances of getting pregnant. And then there are those who find it difficult to conceive. Now this time comes, they get this precious pregnancy. Okay, they are probably getting old, they are in their late 30s, then by chance they get pregnant. They are so attached to that pregnancy in that they are willing to go all the way, irrespective of whatever comes, they are willing. So even if you cancel them, you tell them that this pregnancy is going to be dangerous to your life, you're going to lose your life, they will be like, let me die, but you're not going to do anything to my baby. So in such cases, you just have to document what the mother really wants. Of course, it's their choice. So we give them the information and let them make a choice. So in such cases, we just document and say that this is what this mother wants, and we let her continue with her pregnancy.
Now, to what extent do you think that the social and cultural constructs of our society have an effect on the uptake of abortion, and how and why mothers would either opt in or out of an abortion? To what extent, in your experience? Like, how many of those would tell you? Because now you've explained to me that there are those who have personal, attachment to their unborn children, but then also, what about those who are, in it for religious reasons, for cultural reasons, maybe for society pressure and that sort of thing? Have you experienced any of those like that?
Yes, you see, we live in an environment that is religious, so religion plays a role, and when we come to religion, it depends on how we define beginning of life. When does life begin? So for some religion, they think that as soon as conception occurs, okay, when a sperm meets the egg and they start they meet and make that they make that starting point, they will think that that is now a human being that is growing. So terminating will be like killing someone. Okay, when you come to other religions, I've had an encounter with some of the Muslims, and for them, some of them will tell you that life begins uh, after 12 weeks. Okay, that's about 3 months. So it depends on how we define when life begins. But most of the religions, they will tell you, do not kill. So if you come to religion, that will be a no-go zone. then the cultures, how we are brought up. Okay, we believe that every child, every pregnancy is planned by God. So you think that when you're terminating this pregnancy, you're actually going against the beliefs, the cultural beliefs. So that also happens, and it hinders, or it affects the decisions of the mothers.
Now, I want us to move on now to the post-abortion care. Who can access post-abortion care in Uganda currently? What kind of mothers are you treating? Are you treating the ones that, because you explained to us the types of abortions, the ones that self-induced, then there are those that happen naturally and that sort of thing. What are the demographics like? What kind of patients are you receiving with regards to post-abortion care?
We get all patients. We get all of them. We get all patients who have abortions. So it is after finding those complications that will tell whether this one was induced or this one was spontaneous, even from the history that we take, and also what we find on examination. Like many of them come in with severe abdominal pain and bleeding. So this pain and bleeding will go on until everything inside the uterus comes out. So whether it is a spontaneous abortion or an induced abortion, they will still come to hospital with the bleeding. Then these other complications can also come in. Now, when we come to post-abortion care, we subscribe to WHO guidelines, okay, post-abortion care guidelines. And we as health workers, we're required to ensure that we give post-abortion care to all patients who need the treatment, because basically it's medical care, it's treatment. So we're required to give care to all the patients who come in with abortion care, with abortion related complications, without having to report them to police that this one has performed an abortion. We need to be confidential, we need to be non-judgmental. Okay, yeah, but of course, because of the environment, we find that there are some issues with some health workers. Okay, so the issues of stigma come in. And of course, when we come
So
to
is it right to say that you will welcome, as health workers, you will welcome any patient for post-abortion care, regardless of how this abortion was performed?
yes, regardless of how it was performed, we are expected to give the care because it is life-saving.
That is the expectation, but is that what is happening? Maybe I
Well,
need to ask what is happening, what's on the ground.
that is not that is not what is happening, because you'll find that some hospitals, some medical centers, because of who is there, because of who is there, the health workers, their attitudes towards abortion, their beliefs towards abortion, then also thinking about the law, you find that some of them do not actually give this care, and you find that patients have to either have to go to other methods, unsafe methods, or they have to look for other people to help them, okay, because they are actually desperate to get out of pain, to stop the bleeding, to get rid of the infection. So if they fall on this health worker who has not had attitude change towards abortion, they won't get the care that is needed.
But isn't this attitude change, doesn't this happen in medical school? Because I'm thinking at medical school, they're meant to prepare health workers, especially gynecologists, for this. So if I really want you to make us understand what happens in medical school, and why do we have doctors that will not. And this is something that we talked about during the conversation with Noor, when we were talking about the law, that there are those health workers who will just plain not, if all the ingredients as prescribed by the law are present, they have the skills, the expertise, they have the equipment, but they just won't.
Well, some medical schools have actually have been omitting things to do with abortion in their curriculums, and actually at the Association of Obstetricians and Gynecologists, we've been running a project advocating for prevention of maternal mortality due to unsafe abortion. We're engaging some of these institutions, the nursing schools, some of the medical schools, to see that issues to do with abortion care, post-abortion care are actually included in the curriculum. So some of the institutions have been omitting this because of the religion, because of the policies of the environment where we're in. So there have been, some of them were being omitted. Okay, but I think going forward, the attitudes are now changing. They are getting up to appreciate that actually post-abortion care is treatment or it's management for management of patients who actually need the care. So the attitudes are changing going forward.
All right, I have some questions from the public already. The public has started. There is a comment button at the bottom right of your screen. Everybody who is listening, you can click on that button and ask the good doctor here some questions or give comments. Now, let me read some for you. We have Peaceful Annette, who says, are there some health implications even after safe abortion? Many young couples are caught up in abortion and they use OTC medication, tablets, I believe. Is this safe and can this risk future fertility? Maybe let's start with that question. I'll ask one by one as you keep answering.
Yes, for any surgical procedure, there are some complications that we expect, and before we do the procedure, we go through the process of consenting. So during this process of consenting, we are supposed to tell the patient what they should expect. Okay, that we are going to do such and such a procedure, we are going to use this medicine. So we tell them about the likely events that can happen. So there are actually implications. So before the patient signs the consent, they should know that something like that can happen. Things like bleeding, like pain, they can happen, and sometimes infections can also happen. Okay, but we try as much as possible to mitigate those complications as we're doing the procedure. Then you talked about the OTC. This is over-the-counter medication. There are several methods of performing an abortion. One of them is the medical method, which is relatively safe and with less complications. However, the medicine has to be taken under the guidance of the medical practitioner. So taking this medicine over the counter, I wouldn't really recommend, because many of the patients that actually we see coming in because they have taken these drugs in probably high doses, and they are having complications because of the high dose that they have taken. So these drugs should be taken under the guidance of a medical practitioner. So I wouldn't recommend that.
All right, somebody asked some more explanation on what is preeclampsia. What is preeclampsia?
Okay. Now, preeclampsia is one of the hypertensive disorders in pregnancy. And this is basically rise in blood pressure during pregnancy. You find someone has been normal before pregnancy, then when they get pregnant, at around when they get to about 5 months, that's about 20 weeks of gestation, the pressure start going up. And when the pressure start going up, they have issues. They start getting the pressure start causing damage to the kidneys, to the liver, to the brain. So this preeclampsia the preeclampsia is high blood pressure in pregnancy, either with
All
the
right.
damage to the organs like the kidneys and the liver and the other organs.
Okay, I can see two requests for microphones to speak, but somebody, I think it's Ken, Elvis has asked, is abortion legal in Uganda? I'm going to ask Noor. I saw Noor on the space, so I'm going to ask Noor to go and answer that question in text, because this is something that Noor tackled. So today we just want to talk about the medical side of things. Bizimungu John says, good work, Dr. David. Uzima Empowerment, they can also treat a woman rudely if they feel she's suffering because of her own lack of knowledge or incorrect behavior. People have strong beliefs and attitude. The cause, one should be treated with empathy and respect. Relate. I didn't understand the question, but okay, let me go to Atiang, Sharon. Atiang says there are actually some health clinics in the rural areas with little knowledge on abortion and care services, but offering abortion service to girls. One of my relatives almost lost her life because she was already 4 months, but was put on abortion pills which affected her. Unsafe abortion is most common in rural areas because they don't opt for safe abortions, which is expensive. They aren't also aware of avenues or hospitals offering safe abortions. And yeah, I think let's take those for now, and then we'll come back to the comments a little bit later. There are many more where those came from, but I'm going to ask Dr. David to answer these, and then we proceed.
Yes, we've talked about safe abortion being expensive, so they opt for the unsafe abortions. When we talk about the expense, the fact that the abortions are restricted to certain areas, uh, and we know that actually couples are having intercourse, they're getting pregnant, they're getting unwanted, unplanned pregnancies. We think that abortion is actually occurring. However, because of the restrictive environment, you find that those who are actually giving the service, they tend to hike the prices such that they chase away the clients. That's why they end up being expensive. However, if the environment accepts to give a service to maybe the prices can come down. I'm sorry for Atiang Sharon about your friend who went to a clinic, but that is what is happening in the country. So the policies and the laws need to really be revised such that people who actually need the service can get it safely.
All right, let's hear from Dr. Otile. Dr. Otile Jacob, please unmute and give us your question or comment.
Thank you, Daniel. Can I be heard clearly?
Yes, please.
Well, thank you, Dr. David. I think Dr. David has elaborated on the concept very well, but I just wanted to flash a little bit of light on some of the key issues that we have mentioned that maybe needed a little more highlight. Now, Daniel, the lawyers on the platform will agree with us that our laws of the land are a little bit vague in most cases, and the laws on abortion is not spared either. Because if you say abortion is illegal, but only can be performed at times when a doctor deems there is risk to the life of the mother, I am the doctor. I am left with the task to decide when the life of the mother is at risk, and I have that liberty to decide on my own. So, as opposed to clearly spelling out why and when it should be strictly legal or allowed, the law just leave it as blunt as that. And now that, as we have already noticed, it's brought a lot of consequences, especially in the reproductive age groups, because yes, you're saying it's illegal, so the health workers are scared to induce abortions, and then the mothers or the girls themselves are also scared to be known publicly that they have induced an abortion. But they will go behind the back door, procure these pills, and induce. Or sometimes you'll be shocked, because I've been in rural settings of central region and northern region, and I've seen people push sticks, push herbs down to sort of start the process. This is someone that you chased away from the clinic as a medical practitioner. They go back, they do this, and then they hide away. Now, the consequence is going to be the process will start from home, they will still hide away. And then what will happen is the products will start rotting or getting septic inside the womb. And now this is a person that is going to be brought to you unconscious. They're in shock. They're septic. And now, what else?
Yeah, thank you, Dr. Watila.
All right.
It's really painful. Uh, Actually, one of my lecturers always told us this story. There was a girl who actually came to him wanting to terminate a pregnancy, but because of the environment, he turned away this girl. So she ended up in bad hands. So by the time they brought the girl back to the ward, I mean, she was the uterus was perforated, she was septic, and the only thing that they had to do was remove the uterus, which was really painful. So they removed the uterus, took the girl back to the ward, and unfortunately, the same person who turned away this girl is the one who was doing the ward round, and found the girl on the ward. It was really painful.
Yeah, I want to hear also from Edgar Mwaka. Edgar Mwaka, you can unmute and give us your question or comment.
Good afternoon, everyone. Daniel, I'm happy to hear you again. Edgar Mwaka here. So I'm here to actually add on what Dr. David Lule was trying to elaborate. And I'll also refer to the comment made by, is it a question? Or yeah, it was a question and an elaboration from Peace. I can see Peace online. And I'm also here to counsel the young people that we have here. First of all, I would like to take you back to what we discussed in the previous chat, in the previous meeting about unsafe abortion and what is happening about the policies that are coming up. Now, the young people that are online here, one thing you need to know is that unsafe abortion, any medical personnel will actually never recommend someone to go for unsafe abortion. And in cases like that, there are complications that come up. Now, in reference to what Peace talked about campus girls inducing abortion, actually, I will call it inducing abortion, is when you go to a clinic, get those tablets, you start the process maybe from your hostel or from home, and then when complications come up, that's when now you go to a medical personnel to actually go and get what they call post-abortion care. There are complications associated with unsafe abortion, and those complications can actually lead to death, because in instances whereby you overbleed and the bleeding cannot be stopped, you will actually lose so much blood, and by the time they rush you to a health center or to a medical personnel, you'll actually have gone long time ago. So it is actually one of the leading number of deaths that we are having around Uganda, especially amongst young people. Now, what Peace talked about is that young people go to clinics and then try to get tablets that will help them induce abortion. Now, that is very wrong. And in case you've had an unintended pregnancy that you didn't desire, for example, maybe you've been having a boyfriend and maybe something happened up and you actually got pregnant and you're not sure whether you want to keep that pregnancy, one, you need to seek counseling from someone mature or someone who can advise you. And if in the due course, maybe, God forbid, and maybe you didn't want that pregnancy, you look for an option. And you see, most of the options that young ladies go for is to terminate that pregnancy, which is not recommended. And they normally start the process. It's because some of these tablets or some of the medication that they use to induce abortion is readily available. And some of these drug shops that we so-called drug shops sell these medications, and you might find the people that are actually issuing out these medications are also, they're not qualified, and they don't even counsel people that actually go to actually buy them. So at the end, you'll always have complications. So it is always recommended that in case you're already having signs of abortions happening or something like that happening, please go and seek medical advice from a qualified personnel. And one thing you need to know, when you reach there, they need to know how old is the fetus, and they need to give you the right treatment. And just like the way Dr. David said, after that, there is care. They need to counsel you. They need to enroll you on family planning. Okay? So for any young person that is on board here, please don't adhere to unsafe abortion. Always seek medical attention from qualified personnel, because this will save you a lot. And also, to add on what Peace said, I believe and think that why people say that abortion is very expensive, because some of the clinics that we have, a young person can walk to a clinic and is actually charged highly for the service that he or she wants to get, especially the young ladies that we have. You'll find someone overcharging for post-abortion care. And that is actually encouraging our young people to walk to these health centers to get some of it. So I urge the medical personnel here, especially those that are working at health centers or clinics, please, when a young person walks to a clinic and wants to get a service of post-abortion care, at least be reasonable and try to help this young person. Thank you so much.
All right, thank you very much. I'm going to go back to the comments this side and then come back to the speakers. Now, I'm going to ask, I did ask Noor, but I think she left the space. But please, someone from SEHAD, I can see Peter on the space. Please, let's have one of the legal minds from SEHAD go to the comment section and answer those questions about legality. We did answer the questions about the legality. Tumwesigire Pastori asks the same question: is abortion legal in Uganda? Please answer my question. Thank you. And I'm not a lawyer, but I'll tell you that the legal expert I spoke to, told me that it is not illegal. It is restricted, but not illegal. Bizimungu John, good work. Okay, I think I already read that one. Aine Hope says for post-abortion care to make sense, abortion should be legalized, so that in case one carries out abortion and they get complication, they can freely seek medical treatment without fear and being judged. And then I have Muzugrua Molondo says, hey Daniel Retire, can Dr. Lukomwa define post-abortion care? Muzugrua Molondo has that question for you, Dr. Lukomwa. Okay, so Dr. Lukomwa, I'm going to give you an opportunity to respond to those, and then we'll hear from another of the of the speakers from plenary.
Daniel, an excuse. Before Dr.
Yes.
David comes in, can I just summarize what I wanted to share with you, please, if that's allowed?
Yeah. Yes, go ahead.
Okay, I don't know where I broke off from, but I'll just summarize in the next maybe 1 minute what I wanted to share with the platform. Now, as earlier was saying, you realize that we are playing games that are not helping any of us, in the sense that we are saying we are restricting abortion, and then yet when the ladies come with complications, we are saying let's do post-abortion care, which is allowed. Okay, I think for me that's where the law needs to stand up very clearly and label this, because you can't say it abortion is restricted or legal, whatsoever legal term you want to use, and then when someone goes home and uses the herbs or tries to hit the tummy with a metal or something and then comes back with complications, you're saying, okay, now I can go forth and give the post-abortion care. So for me, I think that's the gray area that the legal minds can usually advise us on. Now, the other thing that I also wanted to add is, to the ladies, however much we are advocating for abortion to be legal, let's also look at the complications, because I've seen girls that have made it a routine. They know, okay, for me, if I get pregnant, I'll procure an abortion. Then the subsequent time, I'll do the same thing. And it becomes a routine. And this is a person that, however much they are counseled on the risks that come along with constant or continuous or recurrent procuring of these abortions poses to your life, they are unwilling to listen. Because when you look at the post-abortion care, which I'm certain that Dr. David clearly labeled out, one of the key things is we attend to the urgent need. If you've come bleeding, if you're in shock, you've bled a lot, if you have any form of infections that have occurred, those have to be addressed instantly, the things that are putting your life in danger. And then the other aspect of post-abortion care, which I'm certain Dr. David labeled very clearly, is connecting you to other reproductive health services, and one of which is counseling to sort of educate you on some of the dangers of abortions, some of the complications that can rise from abortions, and sort of, because I mean, you've lost a life, probably you're psychologically disturbed, and counseling process should be able to help you out of that. But also, most importantly, in the post-abortion care that I wanted to highlight is that the key thing in the other reproductive health services that one should be told about is family planning methods or contraceptive methods per se. Now, we've said several times that if you find the need to use the morning after pill more than twice a month, then it's more certain that you need a method that is sort of longer acting than the the emergency contraceptives. Because first, the reality is that the pills that we take, each of them has almost 7 times higher dose than the routine family planning methods or the oral contraceptives that we use. So if you find the need of, yes, I need to use the emergency contraceptives, and then, of course, sometimes with if you're sexually active, you're going to need to be using these family planning methods more often than usual, then you rather safer using a longer method that helps protect you, as opposed to loading your body with all these hormones and whatsoever consequences they have. So this is one of the aspects that our ladies should also be informed about, which unfortunately sometimes they are not. And finally, as a summarize, some of the complications that ladies should also be aware of is, if you've survived today, it doesn't necessarily mean, even with the most qualified, I mean, none of us is God. Even with the most qualified, things can go out of hand. We have seen ladies who have had their uterus being perforated in the process. We have seen complications of people developing scars on the uterus and they're struggling with fertility issues in the future. We've seen people who are having incompetent cervix. The cervix, when it reaches second trimester, because of the weight of the baby, the cervix just gives way. So they continuously lose pregnancy. And this usually comes at a time when someone now wants to hold a pregnancy to term. So as we're having this discussion, we should also focus on giving the right information to everybody as we look at the aspect of try to streamline the laws to make it safer for everybody, even the health workers and those who are trying to procure abortion. Thank you very much, Daniel.
All right, thank you so much, Dr. Otile Jacob. I'm going to give an opportunity before David comes back. Dr. David comes back. I'm going to give Brian Akanwanaho an opportunity to say something in 1.5 minutes, and then we'll have Dr. David wrap up, answer all the questions, and also end our space. Brian?
Hello. Hello.
Yes, we
Hello.
can hear.
Are you hearing me, Daniel?
Yes,
Yes, we
Brian,
can
go
hear.
ahead.
Thank you, Mr. Daniel. I think I want to add on what they have been said. My name is Akandwan O'Brien. Me, I'm also a health worker from the village setting where these all problems are coming from. And I would like to say that one of the challenges we are having is that reproductive health services in village, they are not there. When we talk of reproductive health services, we include guidance and counseling. Let's say that a child or a girl has got a pregnancy, and unfortunately in their things, there is no way how she can be convinced to go and seek for reproductive health service. And another one is that in our village setting where I live, at our facility, there is no guidance and counseling services. And it is the one of the most important in our reproductive health services. I think when before terminating the pregnancy, when you sit with this girl and you tell her that this and this, you are going to get this complication, or you give the advantages and disadvantages of abortion, I think the girl child can get you very well. And another one is that we are talking about to do safe abortion, but I think in our Uganda it has just started. Not in all parts of Uganda, but in majority of the parts in Uganda, because an safe abortion will not end in our country. Only that it has just started, because everyone has got a smartphone. So a couple will be enjoying their things, and after, unfortunately, a girl will conceive. The girl will just go to the Google and search for medication of abortion. There, it means that what we are trying to stop is just starting in Uganda. And another thing it is that in our facility settings, adolescents, I think they are most of the population we are targeting, and they are the ones who are practicing this unsafe abortion. So it means that adolescents, they are not given reproductive health services at the facilities. So it means that when she when she when she visits a health center seeking for a family planning, I think we know our midwives of our village. He will say that, what are you doing here? Are you not supposed to be at school? That one we read that the girl will go far without any protection, without any family planning method. So it means that the girl will conceive.
All
Is it
right,
okay?
thank you very much.
There is so in my conclusion there, I urge all means that it should improve on back services, abortion care service, because that will help mortality or maternal mortality in this country. Or else we are going very far in this case. Thank you everyone. Thank you.
All right, thank you very much, Brian. I know that I already said we are out of time, but because of how many questions I've received asking whether abortion is legal, I have like 5 different questions from different people asking about the legality around abortion. Elvis is asking the same thing. Aromadri Nelson is asking, is it possible to legalize abortion in Uganda? Then I have 2 more comments. I want Dr. David to take note of these before I invite him later on to speak. Peaceful Annette, does the post pill affect RBC count in the body? I had a friend who got iron deficient anemia and she claims she was told it's because of frequent taking of the morning after pill. Some more details on that. Then Hope Vineyard says, what are some of the basic components or package that one must focus on while seeking for post-abortion care? Thank you. I think those are all the comments I have here that were written. So now let me hear from I'm going to give a microphone to Peter Ichero, and then after that we'll hear from Dr. David to wrap it up. Peter.
Hello, can you hear me?
Yes, we can hear you loud and clear.
I think just for purposes of clarity, abortion is not illegal in Uganda. What the law does is just to restrict abortion. There are situations under which a medical officer is allowed to assess the situation and carry out an abortion. And so that's why we consistently keep saying that it is not that every time there is a case of abortion, it is an illegality. No, there are situations where the law actually allows that. But overall, it is restricted. I don't know whether my colleagues are online. I think I can see Esther Dafa. She can elucidate on that. I think we have Esther Dafa online and she can, if you can give her the microphone.
All right, I want to look for, if Esther could just request for the microphone so I can give it to her, because I don't seem to see her here. So Esther, if you can get us, please request for the microphone so we give it to you and you explain this issue to the public. But meanwhile, as we get Esther, let's hear from Dr. David. Many questions have been raised, Dr. David. I hope you've been writing them down. Now is your opportunity to answer them.
Thank you, Daniel. Maybe to start this off, someone asked about post-abortion care, what it is. It is actually care for the women with abortion complications. Care for the women with abortion complications. However, I don't think we need to wait until the woman gets complications. There is what we call the harm reduction model. and it is what we are advocating for as the Association of Obstetricians and Gynecologists of Uganda. This involves primary prevention. Many of these unsafe abortions come about because of unwanted, unplanned pregnancies. So in the harm reduction model, we want to prevent one from getting these unwanted, unplanned pregnancies. And this can be done by by advocating for increased use of family planning methods. Of course, we know that in our country the uptake is still very low, so we need to advocate for that, for family planning. And we think that when one uses the long-acting family planning methods, they are going to get a better outcome than those who are using the morning after pills, maybe the daily pills. Many of them tend to make mistakes with them, and you find that they are getting pregnant. Then we also need to put the family in the spotlight. If we have enough counseling at home, sexuality education, everything starts at home. So I believe that many of us here are parents. So if we counsel our children and teach them the dangers of having abortions, of getting unplanned pregnancies, maybe we can reduce the harm. Then there are those who actually end up with the pregnancies. So when one is faced with such a pregnancy and they have made a decision to terminate the pregnancy, how are they going to do it without causing harm to their bodies? So we also engage such patients, such mothers, such young girls in abortion, what we call harm reduction counseling. Many of them, you find they have different reasons why they want to terminate pregnancies. Some of them, they are fearing their parents. Others, they want to continue with school. Others were raped. Others, maybe the boyfriend, they had a misunderstanding with their boyfriend. So when you sit these people down and counsel them about the dangers of terminating a pregnancy, actually some of them have overturned their decisions and they have decided to carry on their pregnancies. I've seen a number of these when you counsel them, they're actually able to take on the pregnancies. However, there are those who have made up the decision and they are standing by their decision. This pregnancy has to come out. So when faced with such a patient, I think we need to guide them. Okay, let's refer them to people who are qualified to actually help them do these things safely without causing complications to them. So referral is actually part of the package. And then there are those who will come with the complications. And mind you, the outcome of this patient determines on the care that they receive. So when they come with the complications, let's offer them good management of the complications such that their quality of life is actually better. Someone asked about the post pill. Does it cause iron deficiency anemia? No, it doesn't. It doesn't cause iron deficiency anemia. However, just like Dr. Otuli said, if one finds herself taking this pill more than twice in a month, then they should think of a long-acting method that they can use. I think that was it for me. I don't know if there are any other questions. Daniel?
All right, thank you very much, David, Dr. David Lukomwa. I'm going to ask you again to give us your final remarks on this issue of post-abortion care and abortion generally from a medical standpoint.
Yes, thank you, Daniel. This should be like maybe an eye opener to the young couples here, to the young girls here, to the adolescents, to the parents. According to the WHO, the state is required to ensure access to post-abortion care to whoever needs the care without prosecution. Then two, the post-abortion care must be available on confidential basis. That means if you are seeking care, your care shouldn't be publicized. It should be confidential. And also, the health workers are not required to report patients who are seeking post-abortion care. So if faced with an abortion, I know this can happen to any of the young ladies here, to the marrieds, as long as they are still in their reproductive ages, it can happen. It can either be a spontaneous abortion, or because of some reasons, they can seek to induce an abortion. So this service is available. So when they are to seek the service, it doesn't mean that when you come to hospital seeking post-abortion care, that you're going to be reported to police. So, but all in all, let's look at the harm reduction. Let's prevent the unwanted pregnancies such that we don't end in situations where we need to seek for termination pregnancies. Let's get pregnancies when they are planned. Family planning methods are available, but because of the misinformations around the family planning, you find people talking about them causing cancer, them causing anemia, maybe the IUD will disappear in the body. Let's get clear information and give the information to the public such that they can use the family planning, and we increase the uptake such that we don't end up in situations where we have unplanned, unwanted pregnancies. Therefore, there won't be need for seeking for abortions. Thank you.
All right, thank you very much, Dr. David. Remember, if you did not join us for the first one, this is the second of 9 in a series. We're going to be talking a lot about these issues to do with abortion, trying to get you the best and the right information about these issues so that everybody who is on this space and everybody that you know can make an informed decision. My name is Daniel Lutaya. I'd like to thank the Center for Health Health, Human Rights and Development, SEHAD, for making sure that we are here. And I would like to also thank, in a special way, Dr. David Lukomwa, Dr. Otile, Jacob, who joined us, and everybody who's been on the space, the speakers, the people who managed to give their questions on using their microphones, but even those who wrote in their questions, thank you very much. And we'll see you next week with another space still about abortion. I'll let you know who I will be hosting in due course, probably by end of this weekend. So watch out on my Twitter page. I'll tell you who I'll be hosting. But thank you very much for getting interested in these issues. We all need health. It is human rights, and we all need to be healthy and all need to live a good life. I'm Daniel Lutaya, and I'm saying bye-bye now. Good evening. See you next week.